older driver safety. So when we're using the term older adults or older drivers, we're generally referring to individuals who are aged 60 and above, but really want to think about how when we're discussing the importance of aging and road users, we are all aging. And so this issue really applies to all of us. But so just keep in mind when we're talking about kind of older drivers or older adults, we're thinking of 60 and above. Next slide, please, Sue. Great, thank you. So in general, we've been driving for most of our lives all across the nation, really thinking about driving as an important component. So losing your license or giving up your license can really be an undeniable sign that aging road users are reaching a point of their life where they may not be able to be completely independent and take care of themselves into the future. So driving really means, is really key to our independence as adults. Most people rely on driving to ensure full independence. Aging and aging drivers are no exception. And really want to, like as anyone, we really want to hold our independence as long as possible. So there are many reasons why, how we can work to maximize aging driving and aging road users' ability to drive for as long as possible. Thinking of Vermont, we're an extremely rural state and don't necessarily have a lot of adequate transportation options. So older drivers in suburban areas as well as urban areas may lack access to adequate transportation options. Think about, I know we have a couple people that are out of state, but if you want to put into the chat, what kind of transportation options do you have within your area for any driver or any person? If you want to put it in the chat, I would love to see what people think of when they think of different options. Many of these alternative options cannot be easily used by older drivers. For example, think about how some older adults may not be physically capable of walking to the bus station. It might be a farther distance than people are willing or able to walk to. Alternative transportation systems also require advanced reservations. I'm curious for all of you in your communities, what kind of options are available? I know that in Vermont specifically, some of these alternative options are like the buses that can come and pick people up, maybe only for people who have physical disabilities or maybe low-income adults, and maybe only cover the trips for medical appointments. Additionally, we're living farther away from our families, so family members might be too far away or maybe too busy to help take someone to the store, pick up their medications or whatnot. And also, older adults might be reluctant to ask for help. So it can really limit someone's quality of life. Next slide, please. And I would love to see if anybody wants to put any thinking about what the different options are within your own community, because I know it's very different in the state. So in thinking about just in general with older drivers, most of them are really safe. They have a lot more experience than younger drivers. They typically use their seatbelts more regularly and also follow the rules of the road. And also they have many, many years of experience handling different road conditions. And so that's super important when we're thinking about driver safety. But then as we age, there's a lot of changes that we can have physically and also mentally. So thinking of there's changes in vision, physical fitness, slower reflexes, certain medications that we might be taking that can influence our cognitive and our abilities, and so can actually kind of cause some safety concerns. Next slide, please. So drivers over the age of 70 have higher crash death rates per mile driven than middle-aged drivers. So middle-aged, thinking about age 35 to 54. Higher crash death rates among this age group is primarily due to increased vulnerability and injury, and that's according to the CDC. So when people get injured, they have worse health outcomes. In 2021, almost 20% of deaths and 17% of injuries on Vermont roadways were among people aged 65 and older. That's part of kind of why we're having this conversation is how can we help people be more safe? How can we help plan as we all age? Next slide. Thanks. So what does that mean for public safety officers? As of 2020, Vermont's considered to be one of the fastest aging states in the nation. And as a part of since we have an aging population, public safety officers and law enforcement must be prepared to really know about the unique needs and challenges faced by older drivers in our rural state, especially when it comes to road safety and keeping older drivers on the road as long as possible. But then also when we come across these people and family members, that we know what the resources are. Next slide. And you can kind of see, like, we're an aging state. We're one of the top. I think we compete with Maine, depending on what year it is. So with our aging population, as a nation, we're getting older. And so it's really going to be important that we know what the resources are. And then also you all are, actively engaged in your communities and wanting to make sure that the whole point of this conversation is to kind of help you all have that conversation and figure out what those resources are. And so I believe, next slide. Next, we are going to talk about, I believe it's Geno, right?
It is.
No, it's John.
Sorry about that.
Sorry, I jumped the gun.
It's okay. Thank you, Stephanie. Well, good afternoon, everyone. It's important to remember that law enforcement plays a significant role in older drivers' safety and assessing impairment during contact at roadside, whether it may be for a traffic offense or involvement in a collision. Next slide, please. Most of our officers have had at least standardized field sobriety testing, or known as SFST, or Advanced Roadside Impaired Driving Enforcement, or ARIDE. These are both trainings that discuss medical conditions that may mimic alcohol or drug impairment. So let's look at some common issues to identify and assess in the older driver population. Next slide, please. So in SFST training manual session 6, during the personal contact phase, for those of law enforcement that remember this, talks specifically about if circumstances exist, you should ask questions about an operator's medical history, to include if they have any physical disabilities, whether they're under the care of a doctor, or if they are taking any medications. These are areas that may be common in older drivers. Medical conditions may also affect the performance of field sobriety tests, with confusion on instructions, and also in the balance and different eye movements, including equal pupil size and equal tracking. Any alcohol impairment suspicions may be ruled out by using a preliminary breath test roadside. It's also important to contact and consider all facts and circumstances. And if you feel that there is impairment and you're not sure of its nature, then you should contact a drug recognition expert for further evaluation in your area. If it appears that a medical event is occurring, EMS should be contacted to respond to the scene immediately. If the impairment is deemed to be medical in nature, there should be strong consideration to submit a driver re-examination request to the Vermont DMV. And you'll hear more about that process from Pat McManamon shortly. Next slide, please. Here are some potential flags when dealing with older drivers and some questions to gauge their cognitive abilities and other areas. Medical conditions such as early dementia, Parkinson's disease, cataracts, diabetes, glaucoma, mild stroke, high blood pressure, and having hearing impairment are just some areas that can affect or have an effect on driving, as well as their inability to follow and respond to any instructions. These are areas highlighted and are certainly more of a cognitive impairment and will need to be addressed appropriately for highway safety. Next slide, please. I won't go through all these, so please take some time to look these over. but this is a list of some other indicators to be aware of that can help to assess the driver. Questioning and follow-up may be necessary to determine the overall risk of the driver's ability to operate a motor vehicle safely. These are areas that may be specific to medical, medication, and vision problems. Remember that alcohol and drug use, licit or illicit, can still exist in the older driver population, and appropriate steps should be taken. Law enforcement plays a key role in identifying and assessing potential risks to all drivers. Taking appropriate action is critical to the safety of all road users. Now I will turn it over to Lieutenant Kevin Geno. Thank you.
Good afternoon, everyone. As John said, I'm Kevin Geno. I'm a lieutenant with the Rutland County Sheriff's Department, and I'm a highway safety coordinator for Rutland and Windsor County. Why officers might fail to document, it's the whole thing about reminding of either my mother or my grandmother. How can you afford a ticket? No one got hurt. I have situations, I can think a few years back when a son and daughter called me at night and said their mother, Judy, was going to call the following morning and report her car stolen. And it's not stolen, they said. We have it hidden in the barn. We don't want her driving anymore. And I had that conversation with them that I can't take a false stolen vehicle report. And they said, well, you'll think of something, and they hung up. And that was leaving me basically to explain what was missing, which I did. The next day, I told her basically that her kids taken the car away because they were scared of the way she was driving, and she thought it was all nonsense or whatever. And anyways, after the conversation, she had a talk, and she started to get her friends to drive her around, which incidentally, down the road, one of them was also just as bad as she was. So, I mean, it's an everyday occurrence out there. I mean, on Monday, as recently as Monday, I was out on Route 4 Interstate with Keston Police Department, and we had 3 senior drivers pass us and not move over. And you stopped them, and finally the third one said to me, how are we supposed to know these new laws? And I'm like, well, it's not a new law. It's been in effect for years. Yeah, but I got my driver's license, 55 years ago. And I'm thinking to myself, wow, they really haven't kept up with the times. And maybe that's a question, Pat can answer further on. I think everybody is trained pretty well now to make referrals if they come across, people with bad driving behavior. And we have the resources to do it. I can think of one that happened a few weeks ago to me. I went to go stop a vehicle. It pulled to the right side of the road. It stopped. I started to get out. They took off. And I thought, oh, here we go. And we went down the road. We stopped in the roadway again and took off. And then we turned left onto a private drive off from Route 4. And I approached the driver and asked, and license, registration, insurance card. And she said, you confused me. And I said, what do you mean I confused you? She said, all those lights flashing confused me. So anyways, I asked for a license, registration, insurance card. She handed me her credit card. And I said, no, I need to see your license. When I finally saw her license, she was born in 1924. So you can put the math together and figure out what's going on here. I did have a conversation with her children later that day, but they wanted me to be the bad guy. I'm not really going to be the bad guy, but I am going to submit her for a retest because that's the options that I have. Documentation is important. It's for us to work closely with DMV on problem drivers. I mean, I'm sure, when you look out and you see a police officer doing a field sobriety test on an elderly driver, well, 9 times out of 10, it's probably not alcohol. And I think John would agree with me. It's more prescription medication. And it's a mixture sometimes. And we are the first line of defense out there. We see it, we hear about it. And I mean, the bottom line is if we don't do something about it, who is going to do something about it? Because as I'm sure Pat will say later, the children are definitely, or relatives are definitely not going to be the people who pick up the phone and say, my mom shouldn't be driving. Can you? And that means law enforcement. Can you do something about it? And it's like, have you had a conversation with him or her? And the answer is always, no, I did not. We were kind of hoping that law enforcement could take the presence in this and talk him or her out of driving anymore. And sometimes it's almost difficult. Like I can remember one specific case, well-known a girl in Rutland. She calls me, mom shouldn't be driving anymore. I'll go look at the right side of her car. It's parked outside the garage right now. So I go up, I look, yeah, the whole side of the car is scraped up from her pulling into the garage and not getting close enough to her side. In defense, the garage was 7 feet, the garage door opening space was 7 feet wide. So that is kind of narrow and tight, but some of the older garages were. And you talk about the cognitive thing with senior drivers. Well, I have two vehicles that are very similar, and I drive one daily. It's my cruiser, and I have another vehicle that's very similar to that. And my wife has a Chevy Equinox. Now, here's the strange thing: a Chevy Equinox has a smaller accelerator and a less wide brake pedal, and they're offset just a little bit. So I go from driving, anywhere from 300 to 1,000 miles a week. And then I hop into her car on a Saturday night and I slide my foot off the accelerator and I think I'm on the brake, and I'm not, because it's over further to the left and it's smaller. So, those are all the changes that you have to pay attention to. And with that, I will turn it over to Pat McMahon. Did I pronounce that right, Pat? Pat?
I'm here. Thanks, Kevin. So I'm Pat McManamon. I am the supervisor for the education unit for Vermont DMV. And I do receive, because I do training on diminished skills, I do receive calls about referrals. And as Kevin was mentioning, family members are usually not receptive to reporting their loved ones. There's a whole variety of reasons why. But one of the main things is when they do contact us and we talk through and we talk about, if you make a referral or a report and the person chooses to go to a hearing, if we order a retest, you would have to testify. And at that point, most family members are not willing to do that because it will cause some friction within the family. State law gives our Commissioner of Motor Vehicles the authority to order a retest when they believe, or the commissioner believes, that the person is not competent to operate a motor vehicle safely on Vermont highways. That competency may be either cognitive or physical skill level. Next slide, please. When a retest is ordered and the person takes the retest, several things can happen. One of it is they can lose their privilege to operate a motor vehicle on state highways. That is not necessarily permanent. If they are having some issues that can be rectified, whether it is maybe they need a medication that will help them out, or some other activities, they can operate a motor vehicle again. We also have the authority through DMV to put restrictions on a person. So if the person is having issues where they can't see at nighttime, we can put daytime restriction only on the license. We can put a restriction on the license that requires them to have another operator age 25 or older sitting next to them, similar to our drivers, our young drivers that are learning how to drive. Is another option that the commissioner has, or another restriction the commissioner can do. But what we look for is, has their behavior or their condition changed that will allow them to safely operate a motor vehicle? And that will require them to go through testing again. Next slide, please. So there are two types of referrals for law enforcement. The standard referral, which is family members, physicians, or law enforcement can go through the standard referral. It is a longer process, and the reason it is because we get the referral, we look at it, and we look for the documentation, especially from law enforcement, because you have access to other documentation where the person may have been stopped previously or may have been involved in something previously. And that's why it's so important for law enforcement to document their involvements with them, so that we can bring that up and get a better picture of what's going on. That can go through the hearing process. If the commissioner sees that the person needs to be retested, we send them, the commissioner or the agency sends them a letter requiring them to do one of two things. A would be to submit to retesting, or B, to notify us that they want a hearing in front of one of our hearing officers. If they fail to do that, their license will go under suspension on a certain date. If they choose to do the hearing, then it goes to a hearing officer, and the hearing officer makes a determination whether the commissioner's assumption is reasonable or it wasn't reasonable. If they find it wasn't reasonable and they find in favor of the person, then it gets dropped at that point. If they find that the commissioner's request was reasonable, then again, the person would have to submit to the retesting. And if they are not successful in the retesting, then we would suspend their license at that time. Again, a lot of times, like I said, it can come from a family member. The problem is they're required to attend that hearing, and a lot of family members will not. What we are finding is that physicians are starting to do referrals. And in Vermont state law, unlike other states, some states require the physicians to report medical conditions that would hinder driving. Vermont does not. It is up to the individual to report any driving, any condition that may affect their driving. So if a person has seizures or something like that, it's up to that person to report it to Vermont DMV. We don't hold anybody else responsible for that under our statute. The other referral is only law enforcement. Only law enforcement can use an emergency referral, and it is used on a very limited basis for the most severe cases. This is the case where this person there's no doubt about it that this person's going to get themselves hurt or somebody else. The reason for that is when the emergency referral is done, it goes right up to the commissioner's office, and the commissioner will order, if she finds or he finds in favor of the referral, they will send an immediate suspension that takes effect at midnight that day. And that will go to the agency that requested the referral, and then they have to serve that letter on the person. So initially, it does not go through the due process. We don't have a hearing initially. However, the person can have a hearing after that, after the suspension takes effect, and the hearing officer will decide whether the referral was legitimate or not. And then again, we would order retesting. But because it's done right away and the lack of due process at the very beginning, we really request that it's only used for emergencies when you do that. Next slide, please. So the referral form, as you can see, is up here. You can find it on our website. And you would fill it out. One thing I want to note here, it asks for the date of birth, and I'm going to ask you in the report that you write the extended or the larger report that you write telling us exactly what is going on. Do not mention anything about age. The reason for that is we want that report, we want the referral to be based on the person's skill level, whether it's cognitive issues or physical issues, not age issues. And if you put the age in the report, the hearing officer will look at it, it's become an age consideration. So please do not put the age inside the report. You put it on this paper or for identification purposes, but in the body of the report, please don't mention anything about age. You can check the boxes with the vision, medical, psychiatric, medication coordination reactions, what you feel is necessary. I will tell you that any retest that we do, even if it's a road test, we are going to require the person to go through a medical, physical. And we're going to want a doctor to submit that. We're also more than likely going to do a vision test on the person also, even though we are only going to do driving tests, which looks at coordination. The reason for that is that the driving test gives us a segment of that person's driving at that time, how they drive. And what that is not really a true way of telling how the person drives, because you may have been dealing with the person at nighttime and we're taking a test at daytime. The weather may have been raining or snowing when you were dealing with them, and we're dealing with them in bright, sunny, 90-degree weather. So the conditions may not be exactly the same, so we're not going to get the same impact from the person's driving ability. And that's why we order the medical and the physical also, to see if there's any underlying medical condition that we need to take in consideration. I can't stress enough the little block that we give there to give the description of what happened. That's not enough. We need a larger report on exactly what was going on, basically from the time you made contact or what you saw prior to contact all the way through contact, and how they were reacting, in order to make a reasonable judgment on whether they need to be retested or not. Next slide, please. So I do want to mention that before we go to this, we used to teach a class at the academy, as well as had an in-service training, and we also did some reach out to the medical profession. And what we found back when we started this, our referrals were back prior to that were in the mid-hundreds to maybe the high hundreds. And what we saw when we started teaching the class back in, I think it was the 2015, 2016 range, we saw a 20% jump on referrals coming from law enforcement and the medical profession, which put us up into the mid 200 range, or low 200 to mid 200 range. Last year alone, we had 249 referrals that for retest. That's a huge jump, and again, that just goes to show us that there are people out there that we need to really be look at, and if their abilities are not there to operate a motor vehicle safely, we need to take care of that and either get them back on the road safely, or have them their license go under suspension. But one thing I do want you to do is, if you do a referral, I want you to ask yourself a question when you're making the referral out. If this person was 20 years old, 30 years old, or 40 years old, would I be making this referral? If your answer is no, then it's age related, it's not skill related. If your answer is yes, that you would make the same referral, then it's based on the person's skill and not their age, and that's what we're looking for. Because our retests need to be based on skill level and cognitive skills, not on their age. And with that said, I want to thank you, and I'm going to pass you on to Howard.
Thank you, Pat. You can go to the next slide, Sue. I just want to briefly touch on the fact that, it can be really hard to have these conversations or make these referrals, but once, people are more aware in their life that these kind of issues are occurring, because sometimes people, family members, healthcare providers might not even be aware of it. And so really getting this conversation started can be really helpful and potentially be able to get drivers back on the road through driver rehab programs. We have 4 across Vermont. And we have lots of different resources available for folks, including driver training classes, and AARP offers classes. So there's just a lot of options. And so once we start knowing that there's a problem, we can really work to remedy it with the resources we have available. So driver rehab is one example. And if you want to go to the next slide, Sue. We have some different resources here. You don't need to write any of this down. We're going to send a full resources list of everything we've talked about today, as well as other comprehensive resources around transportation options, how to have some of these conversations with your family or friends. We'll really try to make it all encompassing, so you have a stuff focused on law enforcement, but then kind of just thinking about older drivers in general. So I think that's all my slides. I'm going to turn it back to Sue, and we're going to leave some time for discussion, questions, just to hear what sorts of things that you are seeing on the roads or challenges. Really want to hear from folks in the audience.
Okay, great. Thanks, Allie. So we'll take some time for questions now. So you can either type your questions into the chat box or raise your hand through Zoom's control panel. So yes, Dale, we will send you a copy of the PowerPoint to your email. So does anybody have any stories they want to tell? I know Lieutenant Geno shared a couple, but I'm sure any of you who are out on the road have some stories to tell.
Hey, Sue, I just had a quick question. I can't find to raise my hand, so I apologize. This is John. I had a question for Pat as far as the emergency referrals. Do you have any breakdown as far as how many of those you typically see on any given year?
I don't have the exact figures, but it's about anywhere from 1 to 5. It's not used a lot.
And can officers still send that via email to the commissioner's office? And if they had an emergency referral, would they need to flag that in any different way?
They can email it to either the commissioner's office or to our enforcement and safety, and flag it in the heading of the email, emergency referral. And that way, the enforcement and safety will walk it over to the commissioner's office if it goes to the commissioner's office. It's right there also. Or they can even email it to me, and I will hand deliver it to the commissioner. And that.
Thank you.
Yes, Stephanie.
So I know we have a wide variety of law enforcement, and then also a couple different DMV programs from different states. One of the things, and I don't remember if we actually talked about this earlier or not, our older driver program, we're really just in our first year right now, and I'm very curious. We would love to hear from you all what you feel like is missing when you're out on the road having conversations, or if someone's adult child is coming up to you saying, hey, we don't know what to do with our dad and they're driving. We're building this program and really would love some feedback, or like oh man, we really wish we had pocket guides to do something. Or I'm curious, with all the law enforcement on this call, like what would you love to see?
Well, I think, speaking for law enforcement, I think we'd love to see how we can deliver the message better, maybe when it gets dumped in our lap, because most of the time, as Pat and John would tell you, it gets dumped in our lap, and then we have to deal with it the best we can. And I'm not sure, you know, a softer message is going to be easy, because taking someone's independence away by taking their driving capability, especially in Vermont, you know, let's face it, we don't have public transportation everywhere. And you just go outside of Rutland City and start going into some towns, and it's like there's no public transportation. The exception is they will probably, in some cases, if there's a dire medical need, the bus in Rutland will make some attempt to try and help that person. But it's difficult at best.
Thanks for that.
Too, Stephanie, that I think, you know, certainly more resources for law enforcement is better. Although I feel like, you know, there's so many guides out there, and, you know, little trifolds that you can put up in your car and your visor. So some of that stuff I think will get used. I just don't know, just because of, you know, all the competing materials I think that law enforcement today are carrying in their vehicles or on their person or their go bags. So I'm not so sure how much traction it'll get, but I think if it gets any traction, I think it's better than, you know, not doing anything.
Thanks for that, John. The other hat that I wear is around overdose prevention. And so I completely understand that. Can we give law enforcement wallet cards to be able to connect people with programs? So I think it's that hard balance, right?
You gotta have a really thick wallet these days.
I know those tactical vests have lots of pockets. I'm pretty sure you can find a pocket. You just got to remember which resource is in which pocket.
Exactly. Hey, that's where I put that thing 3 years ago.
All right, so are there any other questions before we wrap up? Okay, I'll take that as a no. So thank you, Allie and Stephanie, and everyone for attending today's webinar. Once you leave today's webinar, you'll receive a survey on the presentation, and we'd appreciate it if you complete that and provide your feedback. You'll also receive a follow-up email within a day or two with a link to a recording of today's webinar, as well as a copy of the PowerPoint slides that we shared today. On behalf of the Vermont Department of Health, Agency of Transportation, Vermont Criminal Justice Council, Rutland County Sheriff's Department, and the Vermont Highway Safety Alliance, thank you for joining us, and have a great rest of your day.
Thank you, Sue.
Have a great day, everybody.
You too.
And thank you, Jeff, and everyone that participated in the chat. This stuff is extremely helpful, and thank you.